My name is Dr. Mark Katz. I'm a psychiatrist at Centennial Peaks Hospital. I work in the ECT department. So electroconvulsive therapy, or ECT, is where we give a small electrical current to the brain to induce a generalized seizure. This is under anesthesia. I know it can sound frightening for some people. This is actually a very well-tolerated procedure. It's very safe. It's honestly, just based on the data, one of the safest procedures we can do while under anesthesia. So the main way that ECT actually works is by helping the brain develop some new pathways. It's not 100% fully understood in terms of how this functions. We generally consider it as stimulating the release of more neurotransmitters such as serotonin, norepinephrine, and dopamine, and it also helps the brain secrete different growth hormones in the brain as well. These all contribute to the formation of new brain cells as well as the connections between those new brain cells. We use ECT to treat a number of mental health conditions. We use it mainly to treat depression, bipolar disorder, psychosis, catatonia, and other mental health issues.
I'm Dr. Roderick O'Brien. I'm the director of the ECT department at Centennial Peaks Hospital. Electroconvulsive therapy is extremely effective for both mood stabilization and as an antipsychotic treatment. ECT is considered the gold standard treatment for catatonia. Catatonia is typically treated with a benzodiazepine such as lorazepam or Ativan. This is a potentially habit-forming medication and can lead to a lot of different complications for long-term use. There are many conditions that have catatonia as one of the manifestations. This includes schizophrenia as well as depressive conditions and bipolar disorder or schizoaffective disorder. There are also many patients who suffer from autism, Down syndrome, and other neurologic conditions that ECT can be extremely helpful to alleviate this problematic symptom. Sometimes we have a diagnostic uncertainty about whether a person is suffering from bipolar disorder or not. And in these cases, ECT can be a very helpful treatment option because it is effective for mania as well as depression.
So when we compare ECT to medications, we say medications are about 30 to 50% effective. ECT is a bit more effective. We have that jump up to 50 to 80% of people who will get some significant benefits from this.
For most patients, it's expected that they've tried and had less than optimum success with several different medications. ECT used to be considered a last resort. This is because historically earlier forms of ECT had a lot of side effects.
So ECT, electroconvulsive therapy, is pretty stigmatized throughout the past, let's say, half century. ECT started in the 1930s in Italy after they had observed patients who had seizure disorders along with mental health disorders. In their post-seizure state, they actually had improved mental health outcomes. So that gave doctors at the time the idea that maybe we can try to stimulate a seizure and see if it has those benefits. And actually it was pretty effective in terms of stigma. If you think about a movie like One Flew Over the Cuckoo's Nest, it paints this picture of the main character being strapped down to a chair and electrocuted, and it seemed like a very violent process. It's actually quite counter to this image. It's a very calm, almost like anticlimactic procedure. Our idea is that there's not really any seizure movement.
The modern ECT is done with a much more sophisticated technique as well as much more advanced technology. It's really tantamount to comparing modern surgery with its earlier iterations, such as what you might have seen in the Civil War when surgeons were operating or amputating without anesthesia. With ECT, there is the acute series where we conduct ECT treatments 3 times per week. There is the continuation phase where we taper down in frequency. So the patient will come in once a week for a few sessions, and then we will drop down to every other week. We continue to space the interval out as tolerated by the patient, about 5 to 6 months of tapering off the frequency of their visits. Most patients at that time can stop ECT and have about a 65 to 70% chance of staying in remission for the next 12 months. In some cases, the patient will have recurrence of their symptoms, in which case they are welcome to come back and continue doing ECT on a maintenance basis. So ECT can be tailored to the individual based on what they need and what they are experiencing.